Namaste. I am going to talk about pain assessment and taking pain history. The faculty for this topic is Dr. Anurag Agrawal. He is a pain physician working at Ram Manohar Lohia Hospital, Lucknow. The outline of this lecture is why it is important to assess pain, why you should use tool to evaluate pain, what are the components of pain assessment process and how to optimize the pain assessment. Pain assessment in children and in people who are impaired with communication, and pain evaluation tools which are practical for low resource settings, and the conclusion. Coming to a case scenario, you are working in a small rural hospital when Parmanand, a 17 years old male, is admitted after a motor vehicle accident. He is awake, stable and seems to have fracture of his left leg and he is groaning in pain. The surgeon wants to do physical examination, but Parmanand does not allow. So, here the questions are, do you need to assess the pain of Mr. Parmanand? How you will do it and how you should act once you have already assessed the pain of Mr. Parmanand. We will go through the whole lecture and we will come to the answers to these following questions. Pain assessment tools, these are routinely used in any pain management scenario. Palliative care focuses on the pain management and symptom control, and pain management is very important, and in pain management first step is pain assessment. So, when to assess pain? It is done on admission, and when there is a change in medical condition of the patient, like he gets a new pain, and when there is a observation that patient is in pain, there is a verbal or behavior observation, and when the patient or family states that he is having pain. These are the situation where you do pain assessment. It is a multi-modal team approach where patient and family are part of this team, and pain assessment can be done by anyone like doctor, nurses, paramedics, social worker, and even volunteers should learn the pain assessment. It is very simple and various tools are available which are easy to identify, easy to understand and easy to practice. Why is it important to do pain assessment? Pain assessment is first steps towards the planning of pain management, and by doing it repeatedly you can evaluate the efficacy of pain management, whether your medicine is working or not, you will able to find out. It will also help you in deciding the dose of pain medications you are giving, and evaluate the patient other symptoms, functional status and general clinical status in parallel with pain assessment. That is why pain assessment is very important. When it is done, as we said, at first admission or first clinical encounter, then at regular interval after initiation of treatment, like initially when patient is in severe pain, every 15 to 30 minutes you have to do pain assessment, but later on if the patient is admitted with chronic pain, long standing pain, the assessment is done every 6 hours or 8 hours as per the nursing chart. Whenever patient reports a new pain, you have to do again assessment. There are many components of the pain history. First of all, you try to find out location, where is the pain. Second, quality, what type of pain it is. Third is intensity, how severe the pain it is, and duration, since how long the pain is. Then elevating and aggregating factor, which are the things which is relieving the pain and which are the situation in which the pain is aggravated, like after medicine, after consumption of alcohol, movement, positioning, like that. Then impact of this pain on patient's life, whether it is affecting his daily routine, work performance, social context, etc. Then you evaluate the medicine he is taking and any side effects he has because of these medicines. Ask and assess also other symptoms associated with pain, like patient is having nausea, vomiting or constipation or itching or confusion, depressions, like that. So, these are the components of pain history. This is simply done by a PQRST questionnaire +2. This is easy to remember. So, first is P is what are the what are the situation which provocates pain or what are the situation which relieves pain, like what were you doing when the pain started, what relieves it and what exaggerates it. Second is quality. What does the pain feel like? Some people say it is sharp pain, it is dull, it is burning sensation, it is cutting, it is shooting type of pain. This is the quality. Third, R is region or radiation, where the pain is located and where it is radiating, where it is felt in other part of the body as well. Then S is severity of scale. How this, here we will be using a scale to measure the pain. The scale is from 1 to 10, 0 to 10, and timing, at what time the pain starts, how long it lasts and how often it comes during the daytime or at night. After this PQRST question, you ask two more questions. One, what have you tried to relieve the pain and has it worked, means what medicine you have taken and is it effective. Second is, how is the pain affecting your quality of life, like your mood, your ability to work, your ability to do routine work, routine course of life, your sleep, etc. During pain assessment, give enough time, establish a good communication with the patient and give patient opportunity to understand the pain scale and react to it. Use pain indicators according to following hierarchy. Patient reporting the pain on his own, like he will say I am having severe pain, moderate pain, like that. Then you see the underlying pathological condition, what is giving pain. Then you observe the patient about his behavior to the pain, like grimacing, restlessness, like that. You also listen to the family and caregiver who are constantly taking care of the patient. Then you check the vital signs like pulse, blood pressure, temperature, and pain intensity reflects on this vital sign. And this is done only when your patient is not vocal or not able to express the pain behavior. So, self reporting, observation and physiological parameter, these are the types of assessment. Coming to various scale, visual analog scale, this is very popular and highly practiced by all medicals, paramedical and other staff. It is a simple scale from 0 to 10. On 0, on one side it is a 10 centimeter long line drawn on a blank paper. On one side it is written no pain and other side it is written pain, severe pain or as bad as it could be possible. Now, patient is asked what is the score of your pain in this from one end to another end, and he puts a cross, on it. Here is the cross, and that will show the intensity of patient's pain. Second thing is numerical rating scale. Here patient describes his pain as in form of no pain, moderate pain or worst pain, and this is put on the line 0 to 10 numerical line, and if it is moderate pain, the score is between 4 to 6. This is the moderate scale, and severe pain is 7 to 10, and mild pain is 1 to 3. So, this is the numerical rating scale. Then third is verbal rating scale, where patient says I am having little pain, mild pain. Then he says something slightly more than mild pain and something severe pain. As I said, mild pain is numerical rating scale 0 to 4, moderate 5 to 7 and severe pain is 8 to 10. In uneducated people, coming from rural area and not literate, you can also use coins. Fortunately, our rupee coins are correlating with the pain, like 25 paisa is equivalent to 25% of pain, 50 paisa is equivalent to 50% of pain, and 75 paisa is equivalent to 75% of pain, and 1 rupee you can say is equal to 100% of pain. So, this is also way you can use assess the pain by showing the coin or by talking to patient that in 1 rupee what is the amount of pain you have. So, he will say 50 paisa pain, then that is 50% of the pain, which is a moderate pain. All these scales are combined, and it is they have developed a universal pain assessment tool, which has verbal numerical rating scale, verbal scale and expression of the face of the patient. If the facial expression is, if patient is having severe pain, expression will be crying and all. Less than that, there will be grimacing. When the patient does not have any pain, he will be smiling. So, these are the verbal expression. Usually this type of verbal expression scale is used for children. We call it Pain's faces scale, and it is used for children, and one can see the type of face is drawn against which there is a score is given, and as per this you can again differentiate into the severe pain or moderate pain. Now, the category this will be severe pain, right, this will be moderate pain and this will be mild pain. So, this is Pain's faces scale developed by Wong et al. In 2001, it is used for children. Where is the pain? Which part of body is hurting you? This can be, patient can be shown a blank diagram of the body and he can draw the area where he is having pain, and at the same time you can also ask him what is the severity of pain by showing a scale, and if he says his score is 9, means he is having pain of 9, VAS, we call it VAS 9 out of 10, then he can also describe his pain like burning, it is continuous, it is radiating, means going to other area of the body. This is the picture, this can be used for children also. Children can draw given different color for different types of pain, like mild pain blue color, moderate pain pink color and severe pain red color. Then in the picture of body he can use the color and describe the pain location as well as severity. Which are the factors which influence the perception of the pain? The patient is an expert about his or her body and his self reporting is the best and it is very accurate. In communicating, patients rely on patients self reporting. It is affected by variety of factors. Which are the factors which affects this experience of pain? Positive versus negative expectation, mood, cultural background, his behavior in life, his previous experience of the pain and what is his coping ability or adaptation abilities which will affect the perception of the pain. So, but one thing is very sure, when patient says he is having pain, it hurts, always believe him and then you try to assess and evaluate the pain and if it is present you have to treat the pain, this is must. Communication between patient and caregiver, always listen actively, carefully and believe in whatever he is saying, as I said earlier. It is difficult to evaluate pain in patient with communication barrier. With patients there is a language barrier or patient is dumb, deaf and dumb. So, or children, these are the patient, it is patient with delirium, old age patient with dementia. So, these are the patient and children, these are the patient, it is difficult to communicate about the pain. So, we can use various tools as well as body language, facial expression and vital signs and history of patient from the family or caregiver. So, in pain assessment is possible even in newborns, because newborns also feel pain. So, it is evaluated by cued approach. Question the child if verbal and or otherwise you can question the parent or guardian. Use pain rating scale if appropriate, that facial expression scale you can use. Evaluate behavior and physiological changes, as I said, how he is lying in the bed, what are the facial expression, whether he is crying, whether he is eating well, whether he is sleeping well, all these changes will give you some idea about the pain. Secure the patient's involvement, take the cause of pain into account and take action to evaluate and treat it. This is the FLACE flex pain scale, where you observe the behavior in form of the face, expression on the face, how his legs are lying in the small children in the age group of 2 to 5. So, how his legs are lying, what activity he is doing, whether he is crying or not, and consolability, whether difficult to console or he keeps on continuously crying. So, then you derive to a total score and you can evaluate the pain. It is usually it can be used in the awake patient, patients who are awake, and observe him for 1 to 5 minutes, and in patients who are asleep, like children who are asleep, observe for the 5 minutes or longer, and you see the facial expression, body observe the body and legs, whether crying, not crying, and etc. So, if the score is 0, patient is relaxed and comfortable. If the score is 1 to 3, there is a mild discomfort. If the score is 4 to 6, it is moderate pain, and 7 to 10 he is having severe discomfort or severe pain. So, this is the how this scale is used in children. Another scale is Oucher scale. The Oucher is a poster developed for children to help them communicate how much pain or hurt they feel. See, these are the posters developed where there are expression of the children, very smiling and cheerful to very much crying, and child will put the mark, or you can match the child's expression from this picture and you come to a conclusion what type of pain or what is the intensity or pain score in these children. In older children more than 6 years of age, you can use verbal rating scale. You can ask child how much pain he has, slightly more, mild pain, moderate pain or severe pain. In aged population again it can be a challenging or difficult, like they might be having dementia, delirium, difficult language problem, hearing impaired, visual impairment, and all this comes into the makes it a challenge to do pain assessment in these people. Here the self reporting is no more valid and you have to ask the patient, are you in pain? And whatever patient says or reports, believe it. You may be able to use 1 or 2 scale, pain rating scale or yes or no question, and allow time to rate pain, ask more than once and in more than one way, and ask about present pain. So, pain assessment should be part of daily routine. Whenever a patient doctor is taking round or when a nurse is noting down the vital signs of the patient, pain assessment is part of that observation, and pain is considered as 5th vital sign, which are other 4 vital signs are temperature, pulse, respiration and blood pressure, and 5th vital sign is pain score. We measure in terms of VAS, which is very popular visual analog scale. So, nurse is asked to rate the pain every time she takes round, and even doctor has to check the VAS score every time he takes a round. Then tailor the assessment to the patient, age, cognitive ability, literacy, etc. And it is not only academic exercise, and it is part of a planning of your pain management. After assessing pain, you will be able to plan which medicine to be given. After starting the treatment, again you have to do pain assessment to know whether your treatment is working or not. So, pain assessment is a routine in our medical field where patient and doctor and nurses has to evaluate patient's pain repeatedly. Once you have made an assessment, interpret it and carry out the relevant therapeutic intervention, like 0 to less than 3, then there should not be any change in the therapy you are giving. But if the pain is more, the scale is more than 3, then start a typical analgesic therapy or give pain medication or change whatever pain medication is existing. When the pain score is more than 9 or 10, it is a pain emergency. You have to treat it as early as possible, immediately. So, immediately treatment is given in form of injection, either intramuscular or intravenous. Interview the patient about which factors are aggravating the pain and relieving the pain. and by this you can may have some conclusion about the pain and what is causing pain. Like if patient says the my pain is worst in the morning, then it is inflammation. If he says it is constant and severe, then it is some type of chronic pain which can be chronic headache like migraine, chronic shoulder pain, chronic cervical pain, chronic low back pain or cancer pain. When he says pain decreases with the movement, it is osteoarthritis. All our elderly people will say morning their joints are stiff, but once they start doing their routine, slowly the pain becomes less and less. That is typical of osteoarthritis. When the pain is worse on coughing or sneezing, it is radicular pain, means it is connected with some nerve and it is going into the other part of the body. When it is alleviated by cool pack, application of cold pack or ice, then it can be inflammation or chronic pain. Pain is alleviated by heat, it is because of the muscle pain, maybe muscle sprain when you apply hot pack you will feel better. Pain descriptors help to differentiate the etiology of the pain and point to therapeutic strategy. Like burning, electric, short like pain, it is originating from a nerve or nervous tissue. It is called neuropathic pain. And if the pain is dull aching, drilling, remain constant throughout the day, then it is from the nociceptive origin or soft tissues like muscle and tendons, and there is a swelling around wherever the pain is. So, when you come back to our original case studies, now you will be able to have answer to this Mr. Permanence pain. Do you need to assess permanence pain? Yes, definitely. How would you do it? Since he is an adult patient, he is conscious, awake, right? You can use visual analog scale or numerical rating scale, right? How should you act once you have assessed permanent pain? Now, after assessment, suppose his pain is 9 or 10 out of 10, then you will give injection, right. If it is mild, that is score 4 to 6, then you will put him on any tablet, pain management tablet. But since it is a motorcycle accident, he is likely to have severe pain because of immediate trauma and he will need injection to relieve that pain. So, keep this pain scale always in your pocket whenever you are on the bedside of the patient, because you have to evaluate pain of the patient and treat it as early as possible. Thank you very much.